Andrea. I'm going to be your nurse today. So I have an order to place an NG tube and a Foley catheter this evening. Can I verify your name and date of birth? She tells me it's Mary Potter, February 26, 1997, and that matches her wristband. Okay, Mary, before we proceed, are you in any pain right now? She said no. Any allergies that I should be aware of? Okay, no. All right, Mary, I'm gonna go ahead and do some hand hygiene and explain the procedure to you really quickly. So, we're placing the NG tube just to give your stomach a break and to provide some internal feedings because your stomach isn't taking food content as it should. So we're gonna give it a break and see how it does for a couple days. So I'm gonna go ahead and start. I'm gonna go ahead and verify the order, making sure that all my supplies are not expired. So I'm gonna go ahead and sit Mary up to a comfortable position. Okay, Mary, so the first thing I'm going to do is kind of explain how the NG tube is inserted. So I'm going to go ahead and measure the NG tube from your nose to your xiphoid process, and it's going to go in through your nose. It might feel a little uncomfortable. I'm going to give you some water to drink, so as you swallow, I'm inserting the NG tube. If at any point you get uncomfortable or have any discomfort, go ahead and tap me in the hand so I know when to stop. So with that being said, can I touch you? She said yes. Okay, so I'm gonna do some hand hygiene. Once again, I'm gonna put some gloves on. Okay, and I've gathered all my equipment. Okay, I'm gonna go ahead and check her vitals and place an O2 on her finger, just so I can get SpO2 reads on her finger, just to make sure that her oxygen is within limits. Go ahead and open this up. Okay, so I'm going to provide this for her. I'm going to give you this water so that you can drink it as I proceed with the NG tube. Okay. I'm going to go ahead and measure it. In the nose, behind the ear, down to the side of the process. And add about 6 inches to that. So I'm gonna go ahead and mark it. Okay, Mary, I'm gonna go ahead and lubricate it. Place this right here. Toss that. Okay, so as I'm looking at my NG tube, I'm making sure that it's all intact while I'm inserting it. Okay, Mary, go ahead and take a deep breath for me. I'm going to go ahead and tilt your head forward. Here, go ahead and drink water as I'm inserting it. So again, if you feel uncomfortable, go ahead and let me know. I'm looking at her nose, and I'm going to go ahead and do this side. I'm going to go ahead and insert. Doing a good job. Go ahead and keep drinking water. Doing it really well, Mary. Okay, so I'm reaching that point where I have marked it. So I'm gonna go ahead and tape it to your cheek. As well as her gown. Okay. pain, Mary? She said no. I'm gonna go ahead and listen. Make sure that we're not in the lungs. Okay. Okay. I'm gonna go ahead and assess the 4 quadrants. I'm going to go ahead and aspirate some stomach contents. I'm going to go ahead and aspirate it. I'm going to place it on my cup here and check the pH. And it seems that we are in the stomach. Before I hook it up to the suction, I'm going to go ahead and get an order from the provider to get an x-ray just to make sure that we're fully in the stomach before giving any medications or feedings or going any further. So, I think that's about it with that. Okay, Mary, do you have any questions for me? Any concerns or anything like that? She said no. I'm going to go ahead and keep you comfortable. Okay, Mary, it's been a couple days now. I'm going to have an order to remove your NG tube. It seems that your stomach tolerated the internal feedings pretty well. We've given your stomach a break, and we're going to go ahead and try and give you solid foods. So I'm going to go ahead and do hand hygiene, make sure that I give you the order so that I do have to remove the NG tube. I'm going to do some hand hygiene, put my gloves on. Okay, Mary, so as I'm removing this NG tube, it is common that you might feel nauseous, throw up, cough, gag. It's all normal. So I'm going to go ahead and give you this Specimen so that if you do feel like you have to throw up, you can do so on that. It is a very quick process. I'm going to just go ahead and untape it from your gown and your cheek and just recoil it. So if at any point you feel uncomfortable, feel pain, go ahead and let me know by tapping me on my hand. And we'll go ahead and get started. I'm going to go ahead and unhook you from suction. And I'm going to tape it from your gown here and your cheek. Okay, Mary, go ahead and take a deep breath for me. And I'll go ahead and recoil it. Okay, and it's out. I'm going to go ahead and make sure that it's all intact. Go ahead and toss it. Okay, Mary. You tolerated that really well. We're just making sure that your nose is doing well, no irritations or anything like that. I'm going to do some hand hygiene, put some clean gloves, and remove this. Okay. Alright, Mary, I also have an order to insert a Foley catheter. So let's go ahead and get started with that. So the catheter is being placed because you're having some bladder issues and you're not eliminating urine as you should. So we're gonna insert the Foley for a couple days and see how you tolerate that. It is a sterile process, so I do ask that you don't move during the procedure, and we try to keep your legs from moving as much as we can. The Foley is being inserted into the bladder, so is it okay if I touch you and uncover you? She said yes. So I'm going to go ahead and place her in a comfortable working position. Okay, so go ahead and move some stuff out of the way. So I'm gonna go ahead and do some hand hygiene here. Try to roll this a little bit. Okay. Silken glove. So I'm gonna go ahead and recover you, Mary, if that's okay with you. She said yes. Okay. So again, Mary, this process is sterile, so try to maintain as in one position as you can, without moving your legs so much. So I'm gonna go ahead and do some peri-care before I get started. I'm gonna grab some wipes and just making sure I'm cleaning front to back on each side. Toss that one. Get a new one, toss it, and just clean down the middle. Okay, I'm gonna go ahead and remove these. Do some hand hygiene. And then we're gonna start with the sterile process. Try to place this strip on there. All right, so I'm gonna go ahead and place this. This is the lube. Go ahead and toss this. Go ahead and open them and attach this to my catheter. All right. So I'm gonna go ahead and remove this part. Some lube there. All right, Mary, I'm gonna go ahead and start this process. I'm gonna go ahead and wipe you with some iodine. I did verify that you weren't allergic to iodine or shellfish. It is cold, so you might feel some discomfort. If at any point it gets too unbearable, go ahead and let me know and we can stop the process. I'm gonna go ahead and open your vulva and wipe one side, toss it, other side, toss it, down the middle, and toss it. All right, Mary, go ahead and take a deep breath for me. I'm gonna go ahead and insert this. Okay, I've gone return, gone flash. I'm gonna go ahead and pinch up here and go insert a little bit more. I'm gonna go ahead and inflate the balloon. Go ahead and discard that. At this point, place this bag on a solid surface that it won't get pulled on. I'm gonna go ahead and clean out my area. I'm going to remove my gloves, do hand hygiene, apply clean gloves, and I'm going to go ahead and grab a specimen sample. I'm going to go ahead and assess my catheter, making sure that there's drainage. So there is. Normally there would be a clamp, but we don't have one. So I'm going to go ahead and use this to stop my urine flow. Make sure it's around the tubing. I'm going to get my syringe here. Okay. I'm going to go ahead and wipe the area and attach it. And withdraw however urine you need. Placing it in my specimen container, making sure it's labeled with the patient date, time, my initials, and send it to the lab immediately. I'm going to take the clamp off, making sure that it's where it should be on the leg, so giving some wiggle room to move, and making sure that there's no peaks and everything's flowing well. So now a few days have passed and we have an order to remove the catheter. Okay, Mary, so now we're going to remove the catheter. Your bladder tolerated the procedure well. Now you're going to get your catheter removed, and we're going to do some bladder training exercises for the next couple of days. We do expect you to have some retention. It is normal after having a catheter for a few days. And before you leave the hospital, we do expect you to at least void once within 8 hours before discharge. So we're going to go ahead and remove it for you this evening. I'm going to go ahead and do some hand hygiene. I'm assessing the bag, making sure that there is output on there. I'm going to go ahead and apply some clean gloves. I'm going to go ahead and do some catheter care before I remove it, so I'll do some pericare, wiping it each side and down the middle, as well as on the tubing. And okay, I'm going to go ahead and start. I'll remove my gloves, do hand hygiene, applying clean gloves, and I'm going to go ahead and remove the catheter. Okay, Mary, so this process is very quick. I'm going ahead to take off the balloon that's inflated with the catheter, and then I will recoil the tubing, and then it should be over. So I would insert this into here and withdraw back the fluid that's in there. And we did look at the order, and it said that she had about 10 cc's in there. So I'm gonna go ahead and make sure that we have the full 10 cc's, which we do. Go ahead and toss that. Okay, Mary, go ahead and take a deep breath. I'm just recoiling it, making sure that it's all intact. At this point, I'm gonna go ahead and remove it from the bed. And I'm gonna go ahead and document the output and tossing that in the trash. I'm gonna remove my gloves, do hand hygiene, apply clean gloves, and do some peri-care. Assessing the area, making sure that there's no skin breakage, and cleaning the peri area front to back 3 times on each side and down the middle. Okay. All right, Mary. We do expect you to use your restroom before discharge today, and we'll be performing some Kegel exercises to get your bladder strength back up. If you have any questions, concerns, or discomfort, let me know, and I can provide you with some medication or ways to keep you comfortable. Do you have any questions for me, Mary? She states no. I'm going to go ahead and provide some more education that it is common to have some retention after having a catheter, and that we will get her bladder strength up again and have her have regular voids. And I'm going to go ahead and document and chart.